Chapter 40, Care of Men with Reproductive Disorders. The male reproductive system can be affected by many diseases, disorders, and medications. The urinary system and reproductive system are so closely linked in the male that a disorder in one system is more than likely going to affect the other system. Erectile dysfunction has psychological and organic causes that will include vascular, neurologic, hormonal, drug-induced origins. The primary intervention for this dysfunction is modifying the reversible cause of the problem. Spinal cord injuries, neurologic disorders like multiple sclerosis, diabetes mellitus, or urinologic surgery, also the side effects of various medications can cause various issues with ejaculation. The pathology for infertility related to a man may be corrected with medications, hormone therapy, or surgery. In vitro fertilization or intracytoplasmic sperm injection after sperm extraction may often be successful. The fluid accumulation in a hydrocele may be due to an infection like epididymitis or orchiditis, or could be due to an accumulation after a trauma. A hydrocele involves the interference with the lymphatic drainage of the scrotum. Fluid intake should be increased to help prevent fluid deficit, reduce fever, increase urinary flow, and remove the debris and bacteria. Patients should be taught to wear scrotal support after any treatment or intervention. The cremasteric reflex is the retraction of the testicles when the inner thigh is stroked on the man. Nurses need to provide routine postoperative wound care with emphasis on providing support and relieving any anxieties that are concerning for the man's self-image as well as their future sexual performance. Sickle cell disease is the most common disease that causes priapism. This causes a local accumulation of red blood cells or erythrocytes that results in engorgement of the corporeal bodies. Circulation to the penis may be compromised, and voiding may be impaired while the penis remains erect. So prompt treatment is essential. They can do an aspiration of the corpora cavernosa with a large bore needle or a shunting procedure to divert the blood. This will help prevent ischemia of the penis. The penis will curve upward with an erection in Peyronie disease. This may cause an inability to penetrate the vagina, and the erection may become painful, as well as it causes embarrassment for the man. These are various diagnostic tests that may be used to help diagnose any disease processes or issues with a man. In the later stages of BPH, there may be complete obstruction of the urinary flow. Urinary stasis or retention of urine is when there is more than 60 milliliters of residual urine in the bladder after the man voids. A gradual dilation of the ureter, known as a hydroureter, and the kidneys, which is a hydronephrosis, can occur in BPH. A digital rectal exam can reveal an enlarged prostate. The actual gold standard test for bladder outlet obstruction is increased bladder pressure relative to urinary flow. A transrectal ultrasound will differentiate benign prostatic hypertrophy from prostate cancer, and a serum creatinine level can rule out renal insufficiency. Plant extracts like saw palmetto have been shown to be effective in minimizing symptoms that are associated with benign prostatic hypertrophy. The most effective way to reduce symptoms is through surgery. Surgeries can include a transurethral resection of the prostate, a transurethral incision of the prostate, laser photoselective vaporization of the prostate, and an open prostatectomy. A 65-year-old man has decreased caliber of urine stream, hesitating, dribbling, and urgency, and a DRE revealed an enlarged prostate gland. Nursing interventions would include decrease caffeine and artificial sweeteners, limit spicy foods and alcohol intake, apply a condom catheter, restrict fluid intake, plan a timed voiding schedule. The correct answers are 1, 2, and 5. Minimally invasive procedures like a balloon dilation, a transurethral needle ablation, laser resection, and microwave thermotherapy are new techniques that may help relieve symptoms related to the prostate. They are more effective than medications, but they're all less effective than surgery. The PSA is the prostatic specific antigen. This is produced by the prostate tissue and is elevated in BPH, cancer of the prostate, prostatitis, and having a prostate biopsy. Interpretation of PSA levels should consider any diagnostic procedures that have involved the prostate gland. An elevated prostate-specific antigen is not always indicative of cancer. There are two approaches to doing a prostatectomy. A is a retropubic approach that involves a midline abdominal incision. B is the perineal approach. This involves an incision between the scrotum and the anus. Potential postoperative complications are bleeding, urinary incontinence, and bladder spasms. Because hemorrhage is always a danger, vital signs are taken per agency protocol, then every 4 hours. The patient is monitored for signs of pallor and rising blood pressure changes and rising pulse. This may indicate excessive bleeding and shock. A high-fiber diet and a stool softener may be prescribed to prevent straining, which will increase the intra-abdominal pressure and can cause further bleeding. Blood-tinged urine is normal for the first few days after surgery. If the patient has a bleeding risk, an irrigation system may be used to maintain patency of the catheter. To decrease clot formation, bladder irrigation flow rate is adjusted to keep the urine dilated to a reddish pink, clearing to pink tinge within 48 hours. When the nurse cares for the bladder irrigation system, only sterile normal saline is used unless otherwise ordered by the physician. The nurse will monitor the rate of irrigation and record intake and output. The nurse will ensure that the recorded amount of irrigation instilled and the amount returned will equal the difference is the urine output. Want to ensure that the drainage tube is straight and patent, and observe for signs of bladder spasms and medicate as necessary. Many inflammations and infections affect the male reproductive system, and they're similar to the female reproductive system in cause and effect. Epididymitis, there's groin pain, swelling, and pain in the scrotum. In younger men, the major cause of epididymitis is chlamydia, a sexually transmitted organism. Symptoms may include scrotal pain, swelling, induration of the epididymis, and eventual edema of the scrotal wall. The testes may also become involved. Bilateral orchitis is serious and often causes sterility. Mumps orchitis occurs in about 3 to 10% of males who have mumps disease. Prostatitis is an inflammation of the prostate that occurs from an infectious agent or other causes. Symptoms may include urinary tract infection, pelvic pain, sexual dysfunction, and they can often be mistaken for benign prostatic hypertrophy. Cancer of the penis is rare, and when it occurs, it's mostly in men that have human papillomavirus infections or those that were not circumcised. Testicular cancer occurs most commonly in younger men at a rate of 1 in 250 men. It is a highly treatable cancer. The men most at risk for testicular cancer are those that have had an undescended or partially descended testicle. Carcinoma of the prostate is the second most common cancer that affects men. When surgical therapy is indicated, a laparoscopic radical prostatectomy is considered the most effective treatment for long-term survival before metastasis occurs.